The youngest I've seen in the clinic is 4 days old. So they came home from the hospital. They knew what they wanted to achieve. And they were in the clinic. We had the mother. Yeah.
Wow.
Yes.
Hi, everyone. Welcome to White Swan by Shalini. In today's episode, we have Dr. Aymun Kamal, who is a prenatal and a pediatric chiropractor. And today she's going to help us understand how we can have a healthy pregnancy with chiropractic care and how our kids can have a healthy spine and have good postures.
Hi.
Hi, doctor.
Hi, how are you? Thank you for a nice introduction and for having me here. It's really nice.
It's a pleasure to have you here.
Thank you. I'm looking forward to sharing all the secrets, as you say.
Great.
Yeah.
So, doctor, would you like to share what does a prenatal and a pediatric chiropractor actually do?
So to understand that better, I would like to cover what a chiropractor actually does.
Right.
Okay. So I've got my trusty spine model here.
Oh, wow.
I don't know if you can see it. So chiropractors are healthcare professionals. Okay. We're looking after our spine and our nervous system. If you look at it over here, and I bring it here because, a lot of people are quite visual, and this is a video podcast, so it's amazing. Okay, so this is a spine model, which goes all the way down to your little hip bones, okay? This part over here, we've got the neck, the mid back, the lower back, all the way down to the sacrum, and the big bones, we've got the pelvis here. Our brain sits here. The big bony structure is protecting the spinal cord, which runs down. So we've got our brain, goes down to the brain stem and then the spinal cords, and it branches off to lots and lots of nerves. Okay. These nerves are going to your muscles and to your organs. They're telling me to talk to you. They're telling me to breathe. But a lot of the time, these things are, some things I have to think about to do. Some things are just automatically done, but they're all part of the nervous system. So chiropractors are looking after this nervous system, looking at how we respond to the information that is coming from outside in, any issues of like tension or any stress in the spine and affecting that health, we look after that, okay? So when it comes to prenatal and pediatric chiropractors, prenatal, which are when the pregnant mothers, we're looking at this pelvis here and how the pelvis moves, how the baby moves, and a lot of like what the ligaments and the muscles are doing here to optimize that pregnancy as well.
Great. And how about pediatric?
The pediatric depends what you are coming for. Okay. So we are looking at, optimal health. We're looking at when you're born, if there was any birth trauma involved, if there were breastfeeding issues and how to address that, and how their neck, their spine is moving in terms of what has happened at birth, what the objective is, and now what do we need to do if there's any stresses anywhere, and then we can address that. Okay, they're very gentle, specific, targeted adjustments to their spine, and the pressure that I'm putting on, that is just how you would touch the firmness of like to check the tomato or an avocado. Okay, very, very gentle, very specific to get to the goal that we wanted.
Right, because children are so sensitive.
Yeah,
themselves.
the children are so sensitive, and they also don't have a lot of that musculature like around their necks, especially if we are doing adjustments around in the neck. So just pressure how you would touch a tomato is what the pressure that we're putting on.
So what inspired you to be one?
I graduated in 2015 and I moved to Sydney for my first job.
Okay.
Then I always knew that I wanted to continue on my postgrad into pediatrics because I wanted to help the parents and the young families thrive and have an alternative answer when the conventional medicine is not helping them. So I did that, but then soon after I moved here, we moved to Singapore.
Okay.
So once I started working here, then I enrolled in Melbourne for a 2-year postgrad in pediatrics, and then I got my qualification. So I was working full-time and studying full-time and flying from Singapore to Melbourne every 6 weeks to study.
Oh, wow. So
Yeah.
what's the duration?
2 years.
Okay.
Yeah, so 2 years, 6 weeks, Friday, Saturday, Sunday, you study and you do presentations. and then you do a big like day exam of like which has 15 exams sort
Okay.
of. Yeah.
So it's a wholesome study.
Yes, it's a lot of theoretical and practical studies. So how
Alright.
to adjust, what are the conditions that we're looking out for, how to assess, how to manage, and how to co-manage as well with other holistic practitioners, whether it be physios, your IBCLCs, your osteos, even gynecologists. So yeah.
There's a common perception that we see in a society regarding chiropractors. Okay. They consider that it's not very highly effective.
Yeah.
And secondly, it does more harm than good. What are your thoughts on it?
So I think a lot of like that, it's a great question, firstly. And it comes from a lens of when they don't understand chiropractic very well. And they just unfortunately narrow it down to some pops and cracks. It is so much more than pops and cracks. It's optimizing how your body moves. It's optimizing how your nervous system functions. And when your nervous system functions, how your body will heal, how your body will function, how you develop, it all changes it. There's some great work being done by a neuroscientist called Heidi Havik. And she is a chiropractor herself. She is a PhD neuroscientist. And she is talking about every time we make an adjustment to the body, how the brain changes. And it's a concept of like the brain plasticity, neuroplasticity comes in. It's how our brain learns, adapts, and changes to every input that we give it, and then how it responds to how we live in our society and how we function. So when it is effective when you really understand it. If you want that quick pop and you think your magically years of low back pain that you've had is going to go away, I am not that person. I don't think anyone can give you that answer really. And they're like, hey, you've had that for 10 years or you can't do that. Okay. So it is much more than that. Also, the pop and a crack is actually just the gas bubble releasing. Okay. When you crack your knuckle. Okay. You crack that knuckle, that little capsule releases that air, and that's what it does. Okay, it can be scary, and I completely understand that. If there are other tools to use, if you don't like that popping and cracking, and oftentimes what I'll notice in our clinic is they're okay with me adjusting their pelvis, they're okay with me adjusting the thoracic spine, which is like the mid back and the lower back. They say, oh, please don't touch our neck. And I completely respect that. It's okay. Because the neck sounds can be a little bit louder because they're so closer to your ears. They're like, yep, that's fine. Let's adjust with another way, which doesn't make sound at all. When you feel a little bit comfortable and we move on with our care, we can come back to it. They come back to it and they say, oh my gosh, that feels so good. Okay. So it's perfectly fine to be scared of it. There are other ways to adjust, and you don't have to like not go to a chiropractor just because you're scared of the crack and the pop.
How would it differ from a physiotherapist?
Yeah, our approach. So physiotherapists and chiropractors, our approach and our philosophy is a little bit different. If as chiropractors, again, optimizing that nervous system, making sure that the body is moving well, and addressing that root cause of the concern. If you versus a physio will be rehabilitating a muscle after an injury. If you think of it in this way, that we're two members of the same team, our approach may be different, and you can definitely benefit from both.
Specifically, I need to. I know that if I have this problem, I should come to you or go to a chiropractor.
Yeah.
And if I have the other problem, I should go to a physiotherapist.
Okay.
So how do I know that?
An example would be like, let's say a pregnant woman.
Okay.
So a pregnant woman's been coming to us during her pregnancy because she's got sciatic-like pain. Okay. She's got sciatic-like pain and her pelvis doesn't move well. We will adjust, okay? And at the same time, refer to her physio if it's needed, if it's required, to work on her pelvic floor muscles. So they're stronger, so they're rehab. And I'm giving, the physio can then give her some stretches and some exercises to strengthen that. So 2 different things. Okay, 2 different approaches, but our goal is the same and working in a more holistic manner.
Can we define it as a chiropractor taking care of your back, spinal cord, and your pelvis and your neck?
Not the spinal cord, the spine.
The spine.
Yeah,
okay.
because the spine is the whole structure.
Okay.
Yeah. Spinal cord, we don't look after the spinal cord inside.
Okay. And a physiotherapist does all the other muscles in the body, let's say with
Yes.
leg cramps, hands.
Yeah, so they're more rehab. Here's an exercise, go strengthen this muscle.
Physiotherapy is usually covered under insurance when recommended by the doctors. Is chiropractic care also under insurance?
Yes, it is. In Singapore, we have pretty good insurance coverage, especially like if you're an expat or like if you have your private insurance. So yes, it is covered. You just have to talk to your insurance provider and see if there's a cap to it. So usually we will assess you, give you a treatment plan. If your insurance has asked for a letter, we'll give it to you and then you can claim as you go. So it is covered.
It is covered. Oh, great.
It is covered.
So you know what, during pregnancies, we see that women actually go through certain discomforts such as pelvic pain, lower back pain, and gastric issues, swelling, leg cramps, and many more, especially during the third trimesters.
Yeah.
So how can chiropractic care give us some relief during that time?
So to answer that question, I've got my trusty model here. This is the pelvis. Okay. If you think about it, this is the front and then this is the back of the pelvis. Okay. Your baby sits up here. And there's a really cool analogy, which I use with my patients as well to help them understand of what I'm going to do. It's called the hot air balloon analogy. And it really beautifully captures of the relationship between this pelvis, the uterus where the baby sits, and what the ligaments and the tendons and the muscles are going to do. Okay. If you think of the pelvis as the basket of the hot air balloon, okay, and the uterus as the fabric of the hot air balloon, all your tendons and ligaments, especially the round ligaments at the front that hold the uterus up, attaching to the pelvis in the front, okay, are the cords of that hot air balloon now. Okay, so if there's any shift or tilt or any tension from, prolonged sitting, we're working mothers these days, okay, or poor posture or stresses, or chronic low back pain, the amount of tension and the stress on the pelvis is now going to change. So your basket is a little bit unbalanced, unsturdy now, okay? Your balloon, which now attaches, now because your basket is not stable, the ligaments over here are going to be unevenly taut, okay? Affecting this uterus, which over here where the baby is, causing mum the discomfort and not allowing a lot of space for where the baby moves and grows around in, okay? So what as a prenatal chiropractor does is focusing on the round ligament, focusing on how the pelvis moves, focusing on the sacrum, which is the back over here, all the way down to the tailbone, how this moves and how that nervous system is optimizing for that stressor, for the new information, for the growing belly. So as a prenatal chiropractor, I'm focusing on how to balance this, how to balance that basket, making sure that the ligaments are moving symmetrically and it allows optimal space for the baby to move in and grow around in. And also while focusing on the back where the sacrum and the tailbone is, so you don't have a lot of low back pain, that sciatic pain a lot of women get, which runs down to the back of the leg. It comes quite later on in the pregnancy. Sometimes it's like there right from the start as well. So we're doing that. That's how we do it.
Right. So how do you actually fix them? Do you use some kind of massages?
Yeah. So we use a technique called the Webster's protocol. It's the gold standard of checking pregnant women. And we got our certification from the US. So a lot of chiropractors will use this. And it is a very specific protocol, and which is step-by-step addressing the concerns of this ligament at the back, how it sits, what the tension in the pelvis looks like, then addressing the tension in the round ligaments, which again holds the baby and holds the uterus up, and adjusting the pelvis and the rest of the spine accordingly. So you have to go step by step.
So I can come to you if I have a pelvic pain, or if I have back pain, and if I have swelling?
Yes. So swelling, it depends what you're eating. I think swelling has a lot to do with what you're eating and how much movement you're getting. But ideally, when all of this moves, when your nervous system works optimally and you're getting a lot of movement in, you're eating properly and nothing is tight or stressed out, swelling can be improved. And sometimes the swelling comes and goes, so because swelling is tricky.
And how about leg cramps then?
Yes. Yes, leg cramps, we have noticed definitely. So 2 things with leg cramps, how the pelvis moves and also nutrition again. Yeah.
Right.
So your magnesium and your potassium and everything and what you're eating, definitely. Yeah, it
Right.
plays a really crucial role.
So do you think this only happens during third trimester, or it starts during your second
No,
trimester?
I think what we're seeing more and more lately is a lot of problems are coming right from the start. Again, like with the modern parents, we're sitting down a lot, poor posture. We have a lot of stresses, and that play part into how your pregnancy will go on. So we are noticing low back pain earlier on. Swelling earlier on as well.
So should I come to you as a preventive treatment, or should I come as a reactive? Like when I get the pain,
Yeah.
should I come to you? Or?
Yeah. So a lot of we see a lot of reactive patients. Okay. So you have headache, you have low back pain, you're woken up with a stiff neck, and you will call us. Okay, because you want to address that problem. I do see it as that, because with the daily stresses that we have, and with how we breathe and how we are moving, it can affect long term. Okay, so I suggest when we look at a chiropractic from a bigger lens, it is more than just a reactive. I have low back pain, I should go to a chiropractor.
Exactly.
Okay. So it can be preventative when you think of like, okay, how's my nervous system working? How is the body moving? So for when it comes to pregnant women,
Yeah.
it can be preventative. And usually women start from anywhere from first trimester or later first trimester.
So does prenatal chiropractic care help in baby positioning in a mother's womb?
Yes. So as we discussed, right, in the pelvis, how the pelvis moves, it will really largely dictate how the baby's position is. So the Webster's protocol is really important in dictating how we adjust, is how much room we make and how the baby moves and grows around it. So when you find out around 32, 33 weeks, if the baby is breech, that is also a very good time to come seek care and start care, because we do help with making enough space in the pelvis, making sure that the pelvis is moving well so the baby can move into a more optimal position. So it can help with the optimal baby positioning, yes.
So does it help in natural birth also?
Yes. The role of the pelvis and the pelvic floor is to the pelvis moves better, okay? And the pelvic floor needs to get out of the way, okay? So the uterus can do its job to pushing the baby out and to a more having a vaginal natural birth. So when your pelvis is moving better with no tension, with no stresses, and your back is not hurting from the whole pregnancy, you're able to do what you need to do during pregnancy. Pelvic floor moves out of the way, you get the birth that you want. There are a lot of studies now that say women who have been under chiropractic care, you have shorter labors, more smoother labors, and less interventions as well.
Wow, is it?
Yeah. Yes, it's really cool. We can link the studies if you like.
Right.
Yeah.
So one must go to a chiropractor.
I think so. I think any body work is really important because the body's changing, the body's growing. It's not going to be the same as it was prior to your pregnancy. So it's really important. Even if you had like a bit of my back hurts every now and then, please do something.
We should not take it as a normal thing.
Yeah, it's definitely not normal. It's becoming more and more common.
Right.
And you don't have to sit with the idea of, everyone goes through low back pain during pregnancy. There is help available out there.
Must address those discomforts.
Yeah, absolutely. And optimize that pregnancy so you feel good about it, right? So you go in there walking rather than, I had a really miserable pregnancy.
Exactly. Because lower back pain is something so common during our pregnancies where we tend to overlook it because we think, it's everybody gets it.
We also told a lot of the times, right? We just told, it's just part of the pregnancy. Well, no, don't you want to know what that pain is doing, why it's there, and how it's actually affecting that baby and what's going to happen at labor as well.
So now the pregnancy is done. During postpartum, can women come and see you during their breastfeeding?
Yes, it doesn't matter actually if you are breastfeeding or bottle feeding or formula feeding. We're both mothers. We remember what it's like. Long hours of holding the baby, the newborn. They're sleeping, but you're awake because you're holding them and sitting there for long hours of like, contact naps. If you're breastfeeding, feeds can take quite long at the start, remember? So you heal. You've just given birth. Now you're healing. You're trying to feed the baby and you're sitting down in really awkward positions because you don't know what you're doing. So once in Singapore, what we've noticed is once the women has completed their confinement period, then they will start care to look after themselves so they can look after the baby better. There's no point being so hunched over, trying to feed the baby, or trying to bottle feed the baby and just going, oh, every part of my body hurts and I'm not recovering well. Your body may go into a bit of what we call fight or flight, and then it just becomes normal. I just live with pain. And then 6 months later or a year later, then it starts to really show what happened at the start.
Right. So do you help with the posture?
Yeah. So again, just chiropractic adjustments for the whole body rather than focusing on what your posture is doing at the start, because the posture at that time can be doing a lot of things. Right. So focusing on releasing those areas of tension, focusing on bringing movement back, mobility back, and really working on as a whole. Yeah, right. And enhancing that healing as well in that postpartum period.
So the posture with the baby also, like how to hold the baby and then feed them.
Yes. My area of expertise is not in feeding the baby. Okay. So we will work with like an IBCLC or a doula to help with that.
So I can come during pregnancy and we can come after pregnancy.
Yes. Also, so if you have a spine and you want to make sure it's moving well, you can come see me. Yeah.
Great. When it comes to children, what age group do you see?
Okay. Right from the start. The youngest I've seen in the clinic is 4 days old. So they came home from the hospital. They knew what they wanted to achieve. And they were in the clinic. We had the mother.
Wow.
Yes. So the mother was under care all throughout her pregnancy, even pre-pregnancy. So she knew why she was coming to us. The baby also needed a little bit of help because there were some interventions. The baby came early and needed some interventions, came home and they were like, okay, we're coming to see you because the baby had some breastfeeding issues, so it wasn't latching properly. Instead of doing this motion, now he's chomping at the breast. So we want to make sure how the jaw moves, how the neck moves is now good. Yeah, for optimal sucking.
Wow.
Yeah.
So do you do something with the jaws?
Yeah. So we do a lot of cranial work. Oh. So we will a gloved finger, obviously, a gloved finger into their mouth to release the mouth muscles. We do a lot of cranial work, like right at the top to release that tension. If you think about like how birth is, it can cause a lot of the stresses, and that squeezing motion is actually really good when they're having a vaginal birth. That squeezing motion as they come out of that birth canal, it activates those nerves that are coming off that brainstem and that spinal cord. So, but this baby had a forceps birth. So the forceps, if you think of those big barbecue tongs, that's exactly what they look like. Yeah. So it's a little bit visual, but that's what it looks like. And so it can create a lot of stress here. So now you've put like big barbecue tongs around your baby's neck to make sure that they come out, okay? So it can cause some tension and stress in the neck area, and how those nerves work to the mouth, jaw, and your neck is now affected. So we help with that, to improve breastfeeding outcomes. Yeah.
So would you say that's a birth trauma? Like, would you address it as a birth trauma?
Yes, that is definitely birth trauma. Okay. And any intervention used, whether it be forceps, your vacuum births, your assisted births as well. C-section is one of the biggest actually birth trauma, because instead of how the neck kind of comes out, it's needed. Okay, sometimes it's just needed. I'm a C-section mummy. So it was really needed. My baby pooped in there, and really dark poop, and we didn't have a lot of time. So we needed to make sure that we move fast and we go through a C-section route. And as fast as we moved, my baby still ended up eating some poop. So, C-section, but it's required sometimes, and it's a medical necessity. So, but yeah, it is traumatic. Now, if you think of as we said, right, like your baby's head is now squeezing in a vaginal birth coming out. but now the doctor's taking the neck out, putting the forces. So yeah, and it's from this from your stomach rather than the natural way out.
So what are the most common problems that you see in children?
The most common would be breastfeeding outcomes. Okay. There's more parents now wanting to breastfeed and have a successful breastfeeding journey. So breastfeeding, very irritable baby, irritable, colicky. My baby doesn't settle. We see that. Reflux digestive issues as well. And as they get a little bit older, developmental delays a little bit. So if they're not rolling over, if they're not crawling, they are doing lots of like tippy toe walking for an extended period of time. So we see that.
So when you talk about irritable problems and colic, what would colic mean?
Colic has a definition, and I need to be careful about this, is 3 hours of crying for 3 days, for 3 weeks, for 3 months.
Wow.
Yeah. So it's not a newborn baby who's just come home is maybe more irritable rather than he or she has colic. Okay. So it's this, they don't stop crying, Aymun. I can't tell you. All they do is cry, and it's very, very stressful. Colicky parents, you see them when they walk through the door. You know they are colicky parents. Wes is an irritable baby a little bit. You know, they're irritable. They arch their back when they want to feed. They don't latch very well. They are very, very fussy, and they are newborns and they're already trying to roll over. They're like 10 days old and they're already trying to roll over. That's a red flag. If your baby is trying to roll over and they're a newborn, they're not at 12, 13, 14 weeks, even 16 weeks, and they're rolling over, please go get help.
Okay.
Yeah. It's not normal.
But how do you fix those problems?
So again, we do a full consultation, okay, find out exactly what is going on, what the birth looked like, what the pregnancy looked like, and then we do a full thorough examination, assessing their cranial bones, assessing their neck, and finding out those areas of tension and stress again, and finding out why the baby is so fight or flight rather than rest and digest, okay? Because we see these babies who've gone through birth trauma or very stressful pregnancies, they come out very fight or flight. That is why they're arching their back so much. That is why their jaws are tight, you know. So yeah, examination, we're assessing how the neck moves, how the cranial moves, how the pelvis, that relationship between the pelvis and the cervical spine as well.
Is there any cracking of bones involved with kids?
Absolutely not. No. It's very safe. It's very gentle. And they're very tailor-made adjustments to the baby that is in front of me. No two adjustments look the same. So again, my adjustments can very much look like from checking the firmness of a tomato to very massage-like gentle movements. Yeah. No, absolutely no cracking.
So could you actually take us to the process of how do you go? Suppose if a child comes for a problem like colic that you said, what do you actually do?
So we sit down with the parents, preferably both parents, and take a full case history. Tell me, what are your concerns? What are your goals? Tell me how your pregnancy was. Was it stressful? What were you eating? How much were you moving? Tell me exactly what happened at birth. And even if you were induced, tell me about that, okay? How long was the labor? How short was the labor? Okay? So we find out that how the baby is now born. And then moving on to the assessment, checking reflexes. So reflexes are your two types. So we have your primitive reflexes as well as spinal reflexes. A small example of a primitive reflexes, which would be where we put our finger in your baby's hand and they curl their hand around. Right. Yeah, that's called a little grasp reflex. It's a primitive reflex. Babies are born with that. So we're checking those things. Does the baby do that? Or I tried to put the baby down for an examination and now the baby's rolled over and they're 10 days old. Okay, and then checking for the motion in their neck, how their occiput, which is the base of the skull, how that moves, how their pelvis moves. And then we design a treatment plan for them and we adjust them and we go from there. So every adjustment can look a little bit different over the number of weeks. But the outcome is always more movement, more rest and digest periods for the baby rather than fight or flight. And then another one, if you're depending on when you're coming for breastfeeding outcomes, it will be checking for oral ties. Does the baby have any lip ties or tongue ties, and does that need to be addressed as well?
What does lip tie and tongue tie mean?
So a lip tie or tongue tie is when you have like a piece like a frenulum still attached in a inefficient way, and your tongue or your mouth doesn't move well now. So depending on the function of the frenulum, now if the movement is reduced in the mouth, the baby's not going to latch very well. Okay. So we refer you out to a pediatric dentist, and a little laser procedure may or may not be necessary depending on the function of how that tongue moves.
So how about development delays? How do you help them with development delays?
What's your age, right? Okay, if they're not crawling, okay, why are they not crawling? Is their pelvis stuck? Does their shoulder not move? Was the shoulder stuck at birth? Is that why they can't move their shoulder now? So again, a full assessment of the pelvis and targeted, very specific, tailor-made adjustments.
So between 12 to 18 months, if I bring my child, at least I can expect that he can start walking with your help.
You have a big milestone of walking.
Right.
Then we have little small stones that lead up to that. We have a good range of walking. It's up to from 15 to 18 months. And I know traditionally they've often thought, 1 year birthday, they better be walking.
Yeah.
No, they shouldn't be walking. Are they doing everything before walking that requires you to walk? Okay. So that means, are they pulling to stand? Okay. You have a 13-month-old. Hey, are they pulling to stand? Are they cruising along the furniture? Are they leaving there, just popping their hand off that furniture a little bit and going to the next piece of furniture? So those inch stones, those small stones are very important to get to the milestone. If you came to me at 24 months and said my child's not walking, that's a red flag.
Right.
Okay. What else is going on developmentally? Let's assess that. Okay. What has happened? Has he or she ticked all the boxes so far, or have they never even met those? So then that's another conversation to have, obviously. There's so many contributing factors to that. But yeah, we go through or in your consultation and find out exactly where we fit in and where you may need some extra help. Least I want you to say is, oh yes, they're crawling really well. They're crawling on all fours. They crawl really, really fast, and they are pulling to stand on all the furniture, and they're cruising along the furniture. Okay. And ideally you have never put them in those baby walkers, anything that with those wheels. And most max is they're doing a push walker.
Okay.
So they're doing that. But that too very minimally because, but ideally you've never ever put them on a walker with wheels. So dangerous and not good for them.
Very true. What, according to you, are the best sleeping positions for children and adults?
And adults, okay. Something that you wake up from and you're not in pain, okay? It's such a broad answer.
Yeah.
It is such a broad answer. Some people are like, we love sleeping on our tummy and we feel great. I'll sleep on my tummy and I wake up with pain, okay? So something that's comfortable, something that doesn't create torsion in your spine, okay? That your neck is going the one way and your pelvis is going the other way. Ideally on your side, on with or without a pillow. Without a pillow is fine as well. You don't actually need a pillow. You don't need a pillow because it's perfectly okay for you if your spinal curves are good and your posture is good. There's more and more research coming out actually that without a pillow people sleep just fine. It's a very made up way of doing that. So a pillow that is not too high that pushes your neck forward or not too low that you're kind of doing this now, and a comfortable pillow, comfortable mattress that doesn't have any dips. Okay. So if you need a mattress, turn those around. If you're starting to notice that you were using it in your pregnancy and because of the weight and now it's sunken in a little bit, do you need to change it or do you need to move it, turn it around? On your side, on your back is ideal. For babies, it will be on their back without a pillow unless they really ask for it. Okay. My son is 4 years old. He's only just starting to ask for a pillow, and that too is just for fun. They don't need a pillow. Just on their backs is fine until they can roll. When they're newborns, until they can roll over, they should be on their back. But often at times when they're having a contact nap, they can just be on you or supervised when they're on their tummy.
So no pillow, not a stuffed mattress, and you're saying on our back or on the side?
Yeah, on the back, on the side is fine. Yeah, the kids for developing spines, I would say don't sleep on your tummy. It creates a lot of torsion and the way that the gravity works.
Okay. But on the side, it's okay.
Yeah, side's okay.
Okay.
Side's okay. Yeah.
Okay.
If you need to, if you're a sleeper with your knees up, you can put something like a bolster or another pillow in between your knees. So your pelvis is stacked on your knees on top of each other rather than one leg straight, one leg bent.
With kids spending so much time on screen,
Yeah.
what would be the best posture for them?
How old are we talking?
4 years old.
Okay, great. So
that is the time they actually sit down and start watching TV.
So 4-year-old, so on their bellies and like in a bit of a tummy time position. You know when they're on their if they're using iPads, they can lay down in that tummy time position with their iPads in front of them. Okay. Ideally, I would just avoid iPad and just have a big screen. So no phones, no tablets, iPads and stuff. Just because of how the focus is. So a big screen, if you have a telly, and you do that and you sit on the couch and you do that, watch your TV. How long you're watching is really important, obviously. And anything under 4, there are very clear, strict guidelines by WHO about screen time and how it affects development and how it affects brain development for a baby, especially for under 2s. It's 0 hours. So let's not do that.
Right.
Yeah. I think there's enough research out there to really show that they don't need it. So your baby who's now like this, scrolling through reels and they're 18 months old, I wouldn't do that. And it happens more than you think.
18 months?
Yeah.
Okay.
It happens more than you think. Yeah.
Well,
They know. Yeah, I know.
shocking.
I know. But it happens.
What posture would be right? You're saying long hours are not suitable, but what kind of posture would be good for them?
Oh, so sitting upright with a good spine. If you're on the couch, okay, let's be honest. It's like a 5-year-old, a 10-year-old.
You're always
they want
hunch,
to sit. Yeah, they want to hunch a little bit. They want to sit. TV is their fun time. So if they're watching that, more upright, have a little bit of a pillow at the back for support if you need to. If you're sitting on the couch, your legs can be crossed. Or legs more flat on the ground.
Okay.
If the TV is higher, there's no need to sit now on the floor kind of doing this.
Yeah.
Yeah, so don't do that. So sit on the couch, feet flat on the ground or feet crisscrossed as well, and keeping your back as upright as possible, shoulders back and relaxed.
And a big no-no for any of the small screens.
If you have to use them.
Right.
So we don't have a TV in our house at all. Okay. So if we have to use an iPad, so my son will lay down and like on his tummy and the iPad will be in front of him. That is a rare occurrence, but that's how I would do it for my 4-year-old.
Sleeping on your
No, not sleeping, laying down. Laying down on your
okay.
stomach.
Okay.
Yeah,
Yeah.
so just laying down on your stomach and with the iPad in front of them. So the natural curves of the spine are happening and then they're watching like that.
It's not really holding.
No, not holding
how they
it.
usually do
there.
it.
Yeah. Because when you hold it, you're kind of like this.
Yeah.
Yeah. So very hunched and your neck is now bent as well and your shoulders are forward.
Right.
When you're laying down on your tummy, in the remember the tummy time position that we would do? So that.
For adults too?
Yeah.
Don't go.
Yeah. No,
watching
don't
it.
go. Adults, please.
Yes.
Yeah. Oh my gosh. Am I scrolling? You're like, so
Right.
come up. And
Let's
really, if you're in the MRT over here and the trains, so
Right.
a good way is if you have your phone, have it upright like this.
Okay.
So you're more upright. Do you see how like my posture changed as well? So my phone is here and now I can do more eye level, shoulders relaxed here.
But we usually don't do that.
Which way you don't? No.
We're always looking down.
We're always looking down. I'm guilty of it as well. So it's okay. It happens. But small changes every day. Yeah.
Right.
You don't have to make all the changes today.
What type of chairs should kids be studying?
It's more how you use the chair rather than which chair. You can buy like a $500 chair. And if your kid's not using it properly, what's the point? Or, the gaming chair, they're advertising like, it's the best chair. And then you spend 10 hours sitting on it. What's the point? Okay. Like, I'm just like, I don't want to do that. Okay. So feet flat on the ground. So let's say doing their homework, something that is height adjusted. Ergonomically, you need to check the ergonomics. So height is adjusted. They are now not too bent trying to do their work. And they're also not too high trying to do their work. Feet flat on the ground. You can put, again, a cushion at the back and then doing your work. Okay. As the kids grow, those IKEA table and chair sets are really good, but again, you need to be careful of how the heights are, how the height changes and how you're using it. So feet flat on the ground, more upright position,
Right.
and shoulders back. And so how you use that table and chair is much more important. Yeah.
So I read somewhere that you should consider yourself as a separate entity than the chair, and make sure that don't consider that the chair is there.
Yeah.
And then sit straight upright, and then that's how you should go about it.
Yeah. So another one then also important is sit all the way back in the chair. A lot of the office workers and the kids, I don't know if you've noticed, they will sit right at the edge of the chair. So it's not just kind of like anchoring themselves on their sacrum and their tailbone. Move all the way back and sit comfortably, rather than just going, oh, I just need to get that work done. And now then you're pivoting forward, your head has moved forward, which what we call like an anterior head posture as well. And your shoulders are rolled as well. So
we see kids carrying backpacks, considering they carry every day to school. So what kind of backpacks, or let's say how should they carry it?
So your backpack weight should be 10% of your body weight. So if you're listening to this, first go home and measure, is it even 10% of your body weight? Okay. So that's so important. Then your shoulder straps to be not loose and hanging, more higher. Okay. And if you have that little buckle at the front, use it. Okay. It helps distribute the weight quite evenly across the shoulders. And something, the shoulder pads a little bit more padded and softer, and nothing that is hanging way like the bag down below. Let's not, there's no point.
So when you say 10% body weight, is it with the books that they're carrying in and then considering the body weight?
Yeah.
Right?
Yeah. So when you pack your bag with your lunchbox, with your bottle, and the books, 10% of your body weight. Yeah.
Right.
So it may stress a lot of you out, but have a discussion at school about it. Be like, hey, are there lockers available? Can we change something? And maybe it's time to bring those trolley bags back into fashion a little bit.
Okay.
I don't know. Yeah. It can't be that heavy. They're very small. Their spines are still developing. Their bags just don't need to be that heavy. It really can put a lot of stress every day on it. Or if you can't do that, if you can't reduce the weight, at least then make sure that the shoulder straps are buckled properly. You're using the little clip in the front.
Can you tell us some good healthy habits to keep our spine healthy?
Movement. I cannot emphasize how much we need to move on a daily basis and how much we are not moving. We're not moving enough. Our kids are sitting a lot more than what they used to 10 years ago. So movement. If you can't do anything, you're like, I'm so busy. Go for a walk. That's all I ask for you. Okay, go for a walk. If you're a woman listening to this, start lifting some weights, do some weight training, get your bones stronger. That is a great way to get your bones stronger. Now, I know how much everyone talks about, like, drink milk and your bones will be stronger. Actually, go lift weights and you will be stronger. Okay, and get your kids into activities that gets them physically more active, more agile, more movement in different ways. Playing drums is great. My son plays the drums. It's amazing. But I want him to move, go run around, use those muscles, and use those muscles in a way they're designed to. Climbing, soccer, basketball.
So make sure they are in at least one of the sports there.
Yeah. Yeah, definitely. And a sport that uses a full body, not one-sided. Don't put them in golf. Okay? So don't. Tennis is great. Tennis is a great sport. It's one-sided. Okay, then are they swimming? Are they using the other side of the body as much as well?
How does one know who's the right chiropractor for us?
Firstly, qualification is very important. If you're in Singapore, there are some what we call the bone crackers and the TCMs that sometimes unfortunately pretend that they are the same as chiropractors. So I think really important to go back to the basics a little bit of where they've studied, what are the qualifications behind it. Also, how holistic are they? This is a very holistic, well-rounded profession. And what you may feel that I may be the right person for you, your husband may not think so. Your husband wants a strong man, someone like really firm to go ahead and adjust him. He may be the right person for that. So it's also, you obviously, when you are paying out there. You may not be like, oh, how much money am I going to spend to find the right fit? Qualification and the style of adjusting, because everyone adjusts a little bit differently depending on the technique that they're using. But almost always the objective is the same. So find out what your goals are, and is a chiropractor meeting them? So another thing would be, I think, philosophy is important. Why they do what they do. Are they just addressing your pain, or are they looking at you as a whole person with a spine, or your child who has come to them with these issues, and what other modes are they willing to collaborate? How are they willing to collaborate and get to the goal that you as a parent want?
Could you share with us some successful stories?
Our biggest win at the clinic at the moment is we have a set of twins, and they are premature twins. They have plagiocephaly, or in layman's term, it will be the flat head syndrome. They had a really difficult birth in utero. Obviously, there wasn't a lot of space because there was two of them. So now their head on one side is a lot more flatter to the other. So almost their measurements are they were, when they started care, they were up to 13 and 15 millimeter difference from side to side, and that's recorded as quite extreme. But with under care and adjusting, doing a lot more tummy time at home, doing like smaller exercises with the parents and teaching them how to do the exercises and weekly adjustments. Now the girls sit at 7 millimeter and 6 millimeter, and their head is very beautifully on its way to a round proper head shape. So, and the parents are stoked. They avoid a helmet in this situation. They don't have to wear helmets for a very long time. And yeah, they move better, they feed better, they can do tummy time easier, and they move there. Yeah.
Wow.
Great.
So do you train the parents also?
Yes. So we will give them, because obviously the baby can't do any exercises themselves. So we will teach the parent how to do gentle stretches and little gentle exercises themselves to complement the care. Because sometimes we are only seeing the kid once or twice a week or over a few weeks. But I want you to do some homework in between that. And the biggest homework, if you're listening to this, if you have a newborn, do your tummy time.
Thank you, Dr. Aymun, for coming over. I have a small gift for you.
Oh, thank you so much. I wasn't expecting this at all. So thank you. I really appreciate it.
It was so nice having you here and learning something new.
Thank you so much. I really enjoyed explaining everything to you as well.
Thank you, everyone, for tuning into all our episodes. I hope you get some great insights about parenting. Please share this episode with all your family members and your friends. And don't forget to hit that subscribe button. See you next time.